Receiving a cancer diagnosis is scary and overwhelming on its own, but for some women, it could also mean they'll never be able to carry a baby. The experts here at Orlando Health, though, are helping to change that, and joining us now to discuss fertility-sparing treatments is Dr. Lisa Rubinsak from the Orlando Health Cancer Institute. Thanks so much for joining us, Dr. Rubinsak.
Of course, my pleasure.
Why is cancer treatment such an issue with women's fertility?
So a lot of times when you typically think about a cancer diagnosis, it's in the older women, so the population above 40. But we do have those patients that are under 40 that will be impacted by the stuff that we do. So that's chemotherapy or radiation, all can have an impact on ovarian function and ability to carry a child in the future.
And how do you decide what's best for them?
So it's really dependent first on their cancer, what stage their cancer is, and then also what my treatment plan is going to be. So the first thing that obviously we need to ask is, do you want children, and what is that? Like, what is your family gonna look like, and is that something that you still wanna keep as an option? And then the second thing is it even something that is okay to proceed for fertility sparing in your cancer diagnosis that will not impact your survival? So for cervical cancer, sometimes we can do less radical surgery where we're removing the tumor in the cervix while leaving the uterus and allowing that still to be a potential option in the future. If we have to do pelvic radiation, which generally will take away the function of the ovaries, another option for surgery that I perform would be moving the ovaries outside of the pelvis. So that's an ovarian transposition. And then that allows us to still do radiation with potentially less impact on the ovarian function.
That's pretty incredible. It sounds so simple, but it's a very unique approach that I bet a lot of people don't know about. And on top of that, you use the minimally invasive surgery techniques that are widespread here around Orlando Health for different types of health problems, which means that not only does she have the benefit of being cancer-free, being able to have children at some point in the future, but it's also quicker recovery time, so she can just get back to her life.
Really, robotic surgery and laparoscopic surgery has really revolutionized our cancer care. Our patients go home the same day after most of the robotic surgeries that we do. By 2 weeks, they're feeling back to kind of their normal self, and that's even in cases of a full hysterectomy.
It's another reason to choose well with Orlando Health. And if you would like more information, you can visit orlandohealth.com/cancer.